Okay, hi everyone. My name is Carrie Durward, for those of you who don't know me, and I am an Extension Nutrition Specialist and Assistant Professor at Utah State University. I'm going to be talking today about the gluten-free diet, who should be on it, who shouldn't, its health benefits, and how to go about, we're going to touch the surface of how to go about eating gluten-free. Okay. For those of you who are with us, please do feel free to ask questions as we go along. I'm happy to take questions as we go or at the end if you'd like to save them up, either way. So I think gluten-free diets obviously are very popular these days. As I've been going around and talking to the county faculty, a lot of them have been telling me that they are getting a lot of questions about gluten-free diets. And so the purpose of this talk today is to be able to answer any questions that you might have about gluten-free diets, to be able to talk a little bit about the health benefits, who needs to be on a gluten-free diet, and then, like I said, touching the surface of how to go about doing that. So, if you gluten-free diets have been in the news a ton lately. There are quite a few celebrities who say that they're on them. They say that they're helping them lose weight, feel better, their skin looks better. The food industry in 2012 reported that gluten-free foods totaled $4.2 billion worth of the sales. And a very recent study said that almost a third of adults, 29%, want to either decrease the amount of gluten that's in their diet or completely eliminate gluten from their diet entirely. So I think that that's in line with all of our experiences. I think most people know somebody who's trying to eat gluten-free or who wants to eat gluten-free. And so it's important that we understand the research and are able to talk to people about it. So gluten is a protein complex that's found in some grains. The most common ones are wheat, rye, and barley. So wheat is the primary source for most Americans, and its purpose in food, or its function, is it makes the dough elastic, and then as foods cook, it traps gas, creating bubbles, which give us the light and airy texture. So when you're eating a delicious piece of bread with a nice soft crumb, or a cake, or if you're enjoying the chewiness of pasta or of a bagel, that's gluten that's giving you that experience. So the first group of people that absolutely need to eat gluten-free is people who have been diagnosed with celiac disease. So celiac disease is an autoimmune disorder, meaning that the immune cells in our body actually attack our body's own cells. So in people with a genetic predisposition, when they eat gluten and gluten ends up in their intestine, their immune cells in their intestines are triggered to attack the lining of the intestine. So you can see on the right, the intestine usually has really a lot of surface area because of the villi that go up and down and the pits that are between them. And what happens in celiac disease is those villi are reduced and the pits are reduced, and we end up with a lot less surface area. So this makes it very hard to absorb nutrients properly because surface area is really important to be able to absorb our nutrients. So there's also a discussion about additional triggers, and this is because doctors are finding that celiac disease can develop at any time during life. So somebody who has been eating gluten since they were a child might develop celiac disease in adulthood. And so that seems to indicate that it's not just the genetic underlying trait plus eating gluten, but that there has to be another trigger that happens somewhere in there. But we're not really sure exactly what that trigger is. So the symptoms of celiac disease vary widely. It can look very different from subject to subject, and some people don't have any symptoms at all.
Oh, okay. No, it's blank. It's just
Hi, San
on
Juan. Do you
and
mind
there's nothing
muting?
on TV.
San Juan, welcome.
Okay, you want me to? Okay, and I use that sharp one. Okay. Now I
San
turn it
Juan, can
on.
you hear us?
Now I turned it on.
San Juan, can you hear us?
Oh, which one's the mute? With that cross out?
Thank you.
Okay, sorry about that, everyone. So like I said, celiac disease can look really different from person to person, and there's actually a large portion of people who don't show any symptoms at all. And that's why the large proportion of people who have celiac disease are not actually officially diagnosed. So the symptoms can be what you would typically think of: abdominal pain, GI distress, or they can be more systemic. People experience things like headache, fatigue, rashes. Because we're not absorbing our nutrients properly, you can also have weight loss as one of the main symptoms that people experience, and then they go to their doctor and they're like, I lost weight, I don't understand why, I don't feel well. And then as the disease progresses, we can end up with complications because of the damage that's happening to the intestine. So the most common ones are iron deficiency anemia, just because our intestines aren't absorbing enough iron, or osteoporosis or bone disease, where we're not absorbing enough vitamin D and calcium, and so our bones get weak and brittle. Continuing to eat gluten over your lifetime also can cause people with celiac disease to have a higher risk of intestinal cancer and a higher risk of mortality from that intestinal cancer. So how do we diagnose celiac disease? Well, the first thing that your doctor will do is conduct a blood test to look for antibodies. So there's a bunch of different antibodies that can be tested, and your doctor will choose the appropriate one based on your medical history. So for example, there are some that are more sensitive and specific in children, and some that are better for adults, some that are better for people who have a specific condition called IgA insufficiency. So when a blood test comes back positive, or if it comes back inconclusive, the doctors will confirm the diagnosis by taking a biopsy of the small intestine to look for damage. So this isn't a hugely pleasant procedure. So there's been some discussion in the medical field about whether or not this is really necessary, especially for children. And so some pediatric groups are arguing that, if the antibodies are there, if there's a family history or a first-degree relative who has it, if you definitely have the symptoms that fall in line, that you don't necessarily have to do this. So to get the biopsy, they do have to do an endoscopy. They have to put a camera through your upper GI tract to the beginning of your small intestine, and then take a small sample from your intestine and then put it on slides to be able to see those villi and pits that we were talking about. So on the left here is a healthy intestine. You can see nice long villi extending out into the inside of the intestine and nice deep pits. On the right is somebody who has damage from celiac disease. As you can see, there aren't any more of those villi or fingers, and the pits are much shallower. Now, one thing that's really important, if somebody thinks that they might have celiac disease, they need to keep eating gluten until after they've gone to the doctor for testing. So the reason why this is if you stop eating gluten, your immune system stops responding in your intestine, and it can cause a false negative. So once your immune system stops responding, the amount of antibodies in your blood can go down, and especially if it's early on in disease progression, your intestine can recover to the point where it's hard to see on a slide whether or not you've had this damage. So I've heard different lengths of time from different doctors, but it seems like 4 to 6 weeks of continuously eating gluten before you go in for your testing is going to give you the best shot of getting accurate results from the tests. Any questions about celiac disease before we move on?
Carrie, I have a question. Is it
Okay, go
possible
ahead.
is it possible to outgrow celiacs? If you're diagnosed when you're young, can you outgrow it?
Yeah, so there actually are case studies in the medical literature where people have it and then they don't have it. And so that's exactly what people think is happening. But it's not something that's been studied systemically. It's something where doctors have had case studies, they've documented in the file these diagnostic things, and then, years later, they're not present anymore.
Okay, thank you.
Yep. Any other questions? Okay. So the other condition that causes people to need to avoid gluten is something called non-celiac gluten sensitivity. Basically what this is you have very similar symptoms to celiac disease after gluten consumption, but you don't have celiac disease. So another important difference is in celiac disease, you start experiencing symptoms weeks to months after starting to consume gluten. And in gluten sensitivity, you're going to start experiencing symptoms in hours to days, so it's a much shorter time frame. Unlike celiac disease, where we know pretty well about the immune system pathways that are causing the damage, we really don't know what's causing the symptoms in non-celiac gluten sensitivity. However, people do suspect that there are multiple mechanisms at work just because it presents really differently in different people. An important thing to realize is that in non-celiac gluten sensitivity, we're not seeing any damage to the intestine. So although people are experiencing intestinal discomfort, very similar symptoms, when you take a biopsy, you don't see the same damage has happened. So the list of symptoms is very similar to the list of symptoms for celiac disease. We have the same abdominal pain, GI distress. It's slightly more common to also talk about, nausea, vomiting, bloating, excess wind. And again, weight loss can be a main indicator. People also experience the same systemic symptoms like headache, pain in their muscles or skeletal system, feeling tired, having a rash. We don't know if there are any long-term complications associated with this. In general, people who have non-celiac gluten sensitivity are not showing the same osteoporosis, iron deficiency anemia that we're seeing with celiac disease in later stages. So to diagnose non-celiac gluten sensitivity, the first thing that you need to do is rule out celiac disease. So you do those same two tests that we talked about earlier. And then you need to test whether the symptoms are connected to gluten. And so people usually start by eliminating gluten from their diet. And if their symptoms go away, that's one indication that gluten might be playing a role. However, there's a really strong connection between our mind and our consciousness and how our body functions. So sometimes just when we make a change, we start to feel better. So to really rigorously test it, then you need to challenge with gluten. And you can do this in a couple different ways. An open test is just, take a bite of bread. The patient knows, that they're being exposed to gluten, and the doctor knows that they're being exposed to gluten. The problem with this then is that, especially if you're having subjective feelings like feeling tired or having aches and pains, it's a little bit less clear whether or not your expectations are causing that or your actual reaction to the gluten. So another option is a single blind placebo-controlled. So in this case, somebody at the doctor's office will take food items and put them in solid capsules so that you can't see them. And you will be offered, in one case, at one time, capsules with food, and then another time, placebos. And so this is thought to be kind of the gold standard for most clinical testing. So the doctor knows which is which, the placebo or the actual test, but you don't. But then when you want to go to research or, if you really want to be very rigorous, double-blind placebo-controlled is the way to go. And so this is really important to do it this way because a diet is very complicated and it's easy to misunderstand how your symptoms are connected to diet. So research has shown us that when, not just with gluten, but with all food sensitivities, when we do these double-blind placebo-controlled tests, quite a few people who think that they're sensitive to one food actually aren't. Maybe they're sensitive to another food, maybe their symptoms aren't related to food. And then interestingly, a significant percentage of people who don't think that their symptoms are related to food actually end up having a food sensitivity. So this is why it's very important to pull out the specific food components in this way with elimination and challenge, and why it's important to work with the placebo-controlled test. So just to compare and contrast a little bit between the two diseases. So celiac disease, we know it's an autoimmune disease. Non-celiac gluten intolerance, we don't know what causes it. Celiac disease, we know that it's between 3/4 to 1% of the population here in the United States. Non-celiac gluten intolerance, we really don't know. There haven't been studies done, but I have seen some estimates just from doctors that it's somewhere between 6 to 10% of people. In celiac disease, you're seeing onset of symptoms weeks to years after gluten ingestion. Non-celiac gluten intolerance, it's a much faster time course. You're seeing symptoms in hours to days. To diagnose celiac disease, you need to do the blood tests and then the intestine biopsy. Non-celiac gluten intolerance, you diagnose that. If the person has already ruled out celiac disease, then you do the gluten elimination and challenge tests. The treatment for both is the same, gluten-free diet. Like we talked about, the symptoms are very similar. They look very much the same. Any questions about non-celiac gluten intolerance, gluten sensitivity before we move forward? Okay. So most people know that a gluten-free diet, you can't eat any form of wheat. You also need to avoid barley, rye, and spelt. There's some disagreement about whether or not you need to exclude oats. Oats are pretty commonly contaminated with wheat. So some people say that if you get oats that are tested gluten-free, you're fine. Other people will argue, based on their patients having reactions to oats, that they should be avoided entirely. But most people do okay with oats, especially those that are labeled gluten-free. And so any products that are made out of these flours, so our breads, pasta, cereals, baked goods, breading for fried things like onion rings, etc. But this is not the only place where we find wheat and gluten in the food that we consume. So wheat is commonly used as a filler, as a binder, as a flavoring agent, and so it's important when picking out processed foods to read the label carefully. So I have up here a huge list of ingredients that commonly indicate that there will be gluten in a food. This is not a comprehensive list, so I'm not going to read all of these to you, but the point of this is that people who need to eat a gluten-free diet often need to carry around a list with them at the beginning. And so common things that we're seeing here, so we've got, generic terms like seasoning or flavoring. We've got different colorings, different starches, dextrins, maltodextrin, gelatinized starch, malt products, for example, and then different kinds of vegetable or plant protein. The other thing that people need to be aware of is that wheat gets called by many different names. So sometimes it's just in a different country. So atta is the name for wheat that's grown in India. It's a specific type of flour from a specific species of wheat that's grown in India. This is what's used to make chapati or naan, if you have that at the restaurant. So bulgur is just wheat kernels, but that's what they call it in Turkey. Couscous is an important one to point out to people because a lot of people confuse it with quinoa. So they're both strange names. They're both little round green items, and they're eaten a lot of times in the same way. So again, I won't go through all of these, but so dinkel, inkhorn, emmer, these are all names for different species of wheat. Kamut, you may have heard of as like the ancient grain. And then different names for different types of flour. So semolina, graham flour, cake flour. Farina, most people in the U.S. are aware of, is just a hot wheat cereal. Fu is a gluten food that's found in Japanese cooking. It's usually added to a soup, kind of like a matzo ball soup. Seitan is most often used as a wheat substitute. So common places where wheat or wheat products are added to either act, like I said, as binders or fillers or seasoning agents. So a lot of prepared prepackaged foods, things like salad dressing, sauces, gravies. When we look at processed meats, imitation meats, prepared soups or soup bases, puddings, ice cream, icing or frosting. Different cheese products sometimes have wheat added to it, or wheat products as like a non-stick sort of thing. So that would be your bag shredded cheese or blue cheese crumbles. Things like baked beans, so flavored beans or rice dishes. French fries often have gluten in them, not because the French fry themselves has gluten in them, but because they're fried in oil that is also used to fry things like chicken tenders or onion rings that have gluten in the batter that they're using. So for any items like this, it's very important for people who need to eat gluten-free to read the label carefully, look for those different names for gluten containing ingredients, and pick choices that don't contain those. So doctors are of mixed opinion about whether or not gluten in products like toothpaste, cosmetics, can actually cause reactions, or if they're in small enough amounts that it doesn't matter. But there are definitely anecdotal reports of people who have pretty severe reactions to gluten in some of these products. So that has led to an emerging market in things like gluten-free cosmetics. There are a ton of recipes online to make gluten-free Play-Doh if your child needs to be gluten-free. We all know that sometimes that ends up in the mouth. And there's actually legislation that people are trying to put through so that different drugs that use wheat as a filler or a binder have to be labeled in that way. Right now, the best way to try to figure out whether or not these non-food sources have gluten in them is by doing internet research. So obviously, you can't be certain of anything that you read online, but a lot of people are working hard to try to figure out, okay, which lipsticks can I use, which toothpaste can I use, and posting what they've found online. And the other option that you have is to actually call companies and ask them about the ingredients that they put in their products. Luckily, there are becoming more and more options that are actually labeled, but nobody is regulating those labels outside of the food industry. So it's important to be aware of that. So we went through a whole bunch of lists of foods that you can't eat. The great thing to know about a gluten-free diet is there's a ton of foods that you can eat that are naturally gluten-free. So if we look at grains like rice or corn, things that most Americans are familiar with and already have in their diet, those are easy options. So, you know, meats, so not processed meats, but fresh meats, eggs, dairy that, you know, is minimally processed or fresh, fresh fruits and vegetables, healthy fats, and again, unflavored beans, nuts, and seeds. So looking at this list of, you know, these images of gluten-free food, you might notice that it's a very whole food diet that's being suggested here. So one thing that may explain why a lot of people say that they feel better on a gluten-free diet, even though we don't think that everyone who's going gluten-free really is sensitive to gluten. Sometimes it's because of the changes that you're making in your food choices. So if instead of eating fried chicken, a biscuit, and coleslaw, you're eating a grilled chicken breast, a side of wild rice, and you know, a fresh salad, we know that that's healthier, and we know that healthier food is going to make somebody feel better. It's not necessarily the fact that it's gluten-free, it's the fact that they're actually making healthier choices in an effort to avoid gluten. So there are a lot of grains out there. They're becoming more and more common. You can find them more places. Quinoa is something that has just become hugely popular in the United States recently. So that's the small round grain that you see on the upper right. Corn, obviously, is the one that we're probably the most familiar with. The problem is that a lot of corn products, like if you make cornbread or corn muffins, you're using wheat as well. But so things like corn chips, corn tortillas are good just on their own. And then a lot of other less common products are becoming more common as people look for substitutes and ways to bake and create you know, their typical bread products without the use of wheat. And so one example is teff, that's shown on the lower right. So it's typically used in Ethiopian cooking, and they make a fermented flatbread called injera, which is what's shown there. So gluten-free labeling, the FDA recently released kind of an interim decision. Items that are labeled as gluten-free now have to have 20 parts per million gluten or less. And so this happened recently. Before that, there was no regulation of what it meant to be gluten-free. But they're still trying to figure out exactly what the safe gluten thresholds are. So some people will argue that 20 parts per million is still too much for people who have celiac disease and are very sensitive to gluten. And so that's something that they're still trying to figure out, and they haven't released any rulings about that. So sorry, this is cut off a little bit on the side on mine, but I want to talk a little bit about gluten-free diet deficiencies. So especially if people are just picking up gluten-free substitutes for their usual foods instead of kind of changing the way they're eating and going to some of these more whole foods that we were showing earlier. A gluten-free diet can be low in some essential nutrients. So whole wheat flour we don't usually think of as a great source of iron and calcium, but because it is such whole wheat flour and white flour, because it is such a large part of the American diet, it's actually one of our main sources of these nutrients. So the worry with excluding wheat and whole wheat from the diet is that we will end up with these deficiencies. And there has been research that's been done looking at people who are eating a gluten-free diet, and they do tend to be low in these nutrients. So the ones that we're specifically worried about is fiber. Whole wheat is the main whole grain that people eat in this country. Iron and calcium, and then our B vitamins, so folate, thiamine, riboflavin. So below I've listed quite a few gluten-free sources. It's definitely possible to eat a diet that has all of the nutrients that you need while eating gluten-free. You just need to be a little bit more careful about which foods you pick. So for example, making sure that, instead of just getting gluten-free white bread at the store, if we're using some of these whole grains, so for example, having a side of quinoa instead is going to give us our calcium that we need. It's going to give us our fiber that we need. It's going to add the B vitamins. So fiber, great sources, vegetables, fruits, beans, and the gluten-free whole grains. Iron, so we're going to look to our lean meats, beans, nuts, and seeds, and the gluten-free whole grains. Calcium, so if we're consuming enough dairy as is prescribed by the by MyPlate, you should be definitely fine on calcium. The problem is that the majority of Americans don't eat that much dairy. So then when they get rid of white wheat flour, that's the main source of calcium, they're more likely to be deficient. So again, we need to steer clear of dairy products that are processed and might have wheat as a filler or a flavoring agent. There's also quite a few vegetarian sources of calcium. So the dark green leafy vegetables, almonds, and several of our gluten-free whole grains. So amaranth, teff, and quinoa are all great sources of calcium. B vitamins can be found in our eggs, our milk, our meat. It also can be found in certain fruits and vegetables, our legumes, our nuts and seeds, and our gluten-free whole grains. So I think it's pretty obvious after we've discussed this that if a person is following MyPlate recommendations while eating gluten-free, they should have no problem eating a complete diet. Any questions about that before I move on? Okay. So a lot of celebrities are saying that gluten-free diets have helped them lose weight. And so we already talked a little bit about how sometimes when people go gluten-free, they're eliminating kind of along with the gluten, the processed flour, the processed, junk food that has wheat in it, and going to a more whole foods diet. And this definitely could explain why some people are experiencing weight loss. So if you're going to a more whole foods diet, it's less calorically dense, maybe you're eating smaller portions, these can all cause weight loss. That being said, there's absolutely no research out there. There are no trials in non-celiac patients looking at a gluten-free diet for weight loss. So yes, eating a healthy, whole foods, low-calorie diet can cause weight loss, but there's absolutely no evidence to show that the same diet with gluten in it would be any different. In fact, many celiac patients report that they actually gain weight after starting the gluten-free diet. And this is thought to be from a couple reasons. One, gluten-free processed foods like cookies, crackers, bread, etc. sometimes it's higher in calories than the normal version because they've added fat or sugar to keep palatability and shelf stability where it needs to be. And it's also because celiac patients, when they stop eating gluten, their intestine starts to heal and they start absorbing more calories than they were in the future. So here's an example of how gluten-free doesn't necessarily mean lower in calories. On the left here we have Wonder Bread, and we're comparing it to two different gluten-free brands. And you can see that Wonder Bread is about 70 calories per slice. So it's pretty comparable to the first gluten-free option, but the second gluten-free option is almost twice as many calories per slice. And that's coming from the extra fat. So you can see that the Wonder Bread only has 1 gram of fat, whereas the gluten-free on the far right has 4 grams of fat. and added sugar. So we're going from 2 grams to 3 grams of sugar. So this is why it's really important for people to be reading labels, nutrition labels, not just to look for sources of gluten, but when they're picking up, gluten-free processed foods, to actually compare them to the regular and make sure that they're not getting a lot more calories than they bargained for. So to summarize, gluten-free foods are not necessarily higher in calories, but they can be, and you need to check the label as you would with any other food. So there's a lot of other gluten-free health benefits that people are claiming, and again, unfortunately, there hasn't been any research done to support them. So again, the medical community is of the opinion that, a gluten-free diet can be really healthy, especially if you're going the whole food route, you're following the typical dietary recommendations found in My Plate. But again, there's no research to show that this diet is healthier than the exact same diet that would also include whole wheat in the grain option. And again, I'm talking about for people who do not medically need to reduce gluten. So people who have celiac disease, who have gluten sensitivity, obviously need to eat a gluten-free diet, and it is much healthier for them. I'm talking about the general population, people who don't necessarily have one of these issues. So the problem with gluten-free labeling and with nutrition labeling in general is something called the halo effect. So we know from psychology that if we know one positive thing about a person or thing, we tend to assume that their other traits are positive as well. So a good example of this might be how people tend to think that more attractive people are smarter or nicer than less attractive people. So the same holds true in foods. So when we put health food labels on foods like reduced fat, trans fat free, organic, and I would argue gluten-free as well, people tend to underestimate the number of calories that's in a food. So if you hand somebody a yogurt with the word organic on it, they will say a lower number when you ask them to estimate how many calories are in it than if you hand them the exact same yogurt that doesn't say organic. They tend to serve larger portions. So if you put reduced fat on the outside of a container of coleslaw, people will serve themselves much larger portions and eat more as well. They've also shown that you tend to eat more of other foods as well. So if, for example, they did a study where they looked at people eating at Subway versus Burger King. So at Subway, where Subway has this health halo around it, they've marketed themselves as a healthy fast food restaurant. When people are having the sandwich, they order way more calories inside. So they decide to splurge on the cookies and the chips. And maybe a caloric beverage, whereas at Burger King they're less likely to do that because they think of their main entree as being less healthy. So the problem here, is that the public assumes that gluten-free foods are healthy, and as we've seen, they're not necessarily lower in calories, lower in fat, or sugar. So another big reason why it may not be the best idea for people who don't have to eat gluten-free to consume gluten-free products is because on average, gluten-free foods are over about 250% more expensive than their counterparts. So this data is from 2008 and prices are coming down a little bit, but gluten-free foods do remain quite a bit more expensive than the regular foods. Now, if you are talking about, some of the fresh whole foods that we're talking about that are naturally gluten-free, this doesn't hold true. But when you're talking about like gluten-free bread or gluten-free flour or cereals, that's where this is the case. Other costs are not monetary related. So like we saw, gluten-free foods might contain increased fat or sugar to retain palatability. eating a gluten-free diet can cause social difficulty and just difficulty going about your day-to-day business, eating healthfully. And then we also saw that if the gluten-free diet is not done correctly, we have an increased risk of potential for nutrient deficiencies. The other main point that I would like to propose is that it's really important that we help people understand that they should, if they're worried that they are gluten sensitive or have celiac disease, that they go to their doctor and get tested and get diagnosed. So the reason why I think this is really important is because it's easy to misunderstand the connection between the foods that we eat and the symptoms that we experience. So when we self-diagnose, research shows us that we misdiagnose, that we might not be excluding the right food. The high cost of gluten-free foods, so if you don't have to, you're going to save a lot of money by not doing it. If people start removing the gluten from the diet before they go in for testing, we learn that you can have a false negative on the test, and again, there's an increased potential for nutrient deficiencies. Now, if somebody wants to go gluten-free because they believe there are health benefits, I think that we should respect that decision. We should definitely give them this information that, research doesn't support health benefits for a gluten-free diet above and beyond whole foods, but especially if they're going about it in a whole food way, it's definitely not going to cause harm to them. So just to summarize really quick, so the gluten-free diet is necessary for a small portion of the population with celiac disease, about 1% of our population, or non-celiac gluten insensitivity. So that's estimated at 6 to 10%. Gluten foods are very popular. They're a hugely growing part of the market, and a third of Americans want to reduce the amount of gluten in their diet or eliminate it completely. However, we don't have any research to support health benefits or weight loss from a gluten-free diet for people who don't have celiac disease or non-celiac gluten sensitivity. For individuals that need to consume gluten-free, it's important that they continue to eat a well-balanced diet, choose whole foods, and get enough servings from the different areas of my plate while avoiding different sources of gluten. So that's all I had for today. We do have a few minutes left. I'd be more than happy to take questions or comments.